Hey, Christina. Yes, I can.
Okay. Sorry I'm late. I was actually on the phone with my fiance's rehab center. I talked to Bianca, and
Yes.
she's the one who actually told me to like join the visit or whatever. Um, so a little bit about my fiance, because he's the one with the he had a stroke. At first, he's 32. Back in March 19th, he was on foot and he got hit by two cars.
Yes.
Um, he's suffering from a traumatic brain injury, and
Okay.
due to the trauma, he had a stroke as well. So his left side is his affected side. He has
Okay.
mobility in his left leg, but his left arm not at all. He doesn't move that at all.
Okay.
And he's nonverbal. I was actually I'm gonna talk to Bianca again tomorrow because his cousin was the one who actually told me about you all, and she feels like this would be a good thing for him. And I agree. So I'm supposed to talk to Bianca tomorrow, and I told her that I would kind of give her it's like do a video so she can see exactly what it is that I'm talking about.
Sure.
Anytime that you try to lift his left arm, anything, he cringes. His face
Yep. Yeah.
is just I could tell that it's painful for him. But my concern is that with therapy, I try to have
Hmm.
a close relationship with them so I can reach out and or whatever. But what I'm noticing is, and I know a little bit because my mom had a stroke before she passed, and
Okay.
I'm big on his range of motion. And I feel as though they did an x-ray on his left arm and hand, and they're like, there's nothing wrong, there's nothing broken. And quite
Hmm.
naturally, the natural thing to do when you feel like you're putting someone through pain, if you feel like they're in pain, you stop whatever it is you're doing, you just stop. And I
Hmm.
feel like that's what's happening with him, because he cringes, or you can tell that he's in pain because, like I said, he's nonverbal. But when he cringes and you can see it in his face that he's in pain, I feel as though they're just stopping. And although I appreciate that they're concerned and they don't want to hurt him, I really feel like he needs that range of motion. Like, they don't have to be rough, but you kind of have to, work it out, work the arm out so that he can. I want him to gain, at least a little bit of mobility, because he doesn't move that left arm
Yeah.
or hand at all. At all.
Sure. Yeah. No, Christine, that's really, really good insight. I think you had there. And your intuition is, I think, is exactly right in terms of, you know, I'd say not everyone, but most humans, whenever we see someone's in pain, we want to try
Mhm.
to stop it. Right. So I think that's a very rational thing to think about.
Right.
One thing I want to bring to your attention is there's of course two reasons why we have the perception of pain.
Hmm.
One of them is actual tissue damage, right? If, for instance, there was a broken bone and whenever someone was moving him, and it caused that to move, then that would, of course, be a strong reason to have pain.
Hmm.
The other side, when there's no sort of organic cause, organic is a bad way of saying it because the brain is told technically organic, but we'll call it tissue damage.
Hmm.
When there's no tissue damage, then if following stroke, what could happen is the the brain, the way that we interpret signals, the way we interpret sensory signals, can be
Okay.
altered.
Okay.
So what can happen is this is often called a central sensitization problem, where
Hmm.
we misinterpret
Interpret
normal
what's
movements or
going on. Oh, okay.
precisely,
So it
precisely.
could be, he's misinterpreted, because like I said, they did x-rays, they did
Yep.
everything for the they're like, there's nothing, there's nothing
Yeah.
broken, there's nothing wrong. But I just feel like, because he doesn't move it at all. He doesn't move it at all. And I don't know. I want him to, because he's so young. He just turned 32 back in June. So I feel like, I want him to get as, back to normal as he, as he can. or whatever. And thank God he's right-handed, because this affects his left arm. But
Hmm.
even when I'm there, I try to take his right hand and kind of move it over so that he can touch
Sure.
his left arm, so his brain can realize, like, hey, you have a left arm,
Yep.
use your left arm. I don't know. I just try whatever, but I don't know. Whatever will
Yeah.
help. I just
Yeah.
want to.
No, I think you're very much in the right mindset here, Christine. I think the other thing to mention too is this is a weird thing about pain, right? Pain is entirely in our heads, right?
Mhm,
And so this is not to say that one would be able to differentiate the organic causes, like the actual tissue damage causes, and the causes from central sensitization, right?
mhm,
Those are going to be perceived exactly the same, right? So it's one of these things that, yeah, you could have an actual tissue damage and a central change, but they are very much the exact same thing in terms of our human perceptions. So it's not
mhm.
to say that one is not more or less important than the other. They're very, very important. It's just a matter of how we go about treating them, right?
Okay.
When we think about processes of trying to help people who have these types of cortical strokes that induce pain, we have to be very careful about how we try to move them, right? We have to be very conscious of trying to identify what things are tolerable. And what the
Mhm.
idea is, you want to try to build up that tolerance, and ultimately, it's going to have to be movement and these sorts of things.
Okay.
And it can be very, very complex too if you're not able to move, because then you can actually have real tissue damage, bed sores, these sorts of
Right.
contractures that emerge,
Okay.
all these sorts of things that can happen if
Mhm.
we don't move. So it's super important, right? You're exactly on the right
With the
track with
range of
trying to
Good.
motion.
get,
Right.
yeah,
Right.
with
To
exactly
move.
trying to get him to
Yeah.
move. But it's a
Mhm.
matter of we need to do it appropriately and to accommodate him and make sure that he is going to be as comfortable as possible,
Mhm.
but while still trying to make some progress. So I think maybe these
Mm.
approaches could be good to help identify those ranges of motion where it is painful, and the robot won't move into those ranges that are past what he can tolerate, right? Because we
Okay.
can constrain those things.
Mhm.
So I think these are good approaches, and I'd encourage you certainly to reach out to Bianca. She's really good, and she'll be able to help you
Okay.
kind of identify some good paths forward.
Mhm.
But any other questions you have for me in terms of sort of the applicability, or
Yes.
what other
What
questions
can
can I
help?
help answer?
Say it.
Not really. I mean, no, not really. Bianca did a good job of explaining, what it does or whatever. I'm actually going to have like a consult with her
Okay.
tomorrow. This is something that his cousin and I are really interested in.
Okay.
I do think that this will, help him gain a little bit of that mobility, if not, all. I'm hoping all of his mobility, but yeah, I think yeah, I'm pretty much okay. I just want
Okay.
to show Bianca like what it is that we're actually working with here, because like I said, he's nonverbal, so I'm
Sure.
kind of like his mouthpiece. So
Sure.
yeah.
Well, yeah, that's important too. I hope that you're able to find a way to communicate. If he's right-handed, is he able to?
He writes.
Okay.
He kind of because like I said, he has a traumatic brain injury, so it's
Sure.
like sometimes he becomes, the more and more alert he becomes, sometimes he's a bit stubborn. Sometimes he'll respond to what he wants to respond to.
Sure.
Sometimes if he's over it, he's over it, like he won't,
Yep.
but I try to get him to write. He's not writing in like complete sentences or anything. um it's starting off kind of slow, like this has been a slow process, but he is making
Yeah.
progress. He's not fully, I know he's aware of what's going on. He's aware more than it is that he can put out. I'll put it like that. Like
Okay.
he can interpret what's going on, but he can't just quite get out that he
Sure.
understands, fully what's going on. But I know he
Sure.
knows or whatever.
Yeah, that is very, very consistent. I mean, traumatic brain injuries are they're very heterogeneous, and they often involve these executive function disorders, as well as communication disorders as well. So I very much commend you on your persistence in trying to apply the best strategies for him. This is it's so great that he has an advocate like you. So
Thank you.
it's really good to hear that.
Thank you.
Yeah, and Christina too. You know, ultimately we want to be a resource for you guys insofar as if these approaches, if these tools can be useful for you, then great.
Hmm.
Then we want to do is all we can to help you. But don't think this is the last time that we can chat. If you have more questions, feel free to reach out to us.
Okay.
And like I said, I'm a resource here on the technical, the scientific, and clinical sides. So don't hesitate to reach out to us. And if and Bianca's really good, but if you guys need me to step in, I'm happy to come in and then provide some insights there as well.
Okay.
Okay, well, Christina, this is really good to chat with you, and thank you so much for the background and the insights. And hopefully, we'll be able to work with you guys going forward.
Thank you.